Director and the moderator for Educational Engagement Round. Um, Today's title or the topic for presentation is Integrating Medical Humanities in the Curriculum. And the format of today's session is half an hour presentation by Dr. Zareen Seema Siddiqui, followed by panel discussion and question answer with the panelist. If you have, we have 100 plus registration for this session, and we are still waiting for other participants to join. If you have any question, if you have any comments, please share your comments and questions via the Google form that has already been shared in the chat box. Okay, so I would like to introduce our speaker, Dr. Zareen Siddiqui. Dr. Zareen Seema Siddiqui, she is an associate professor in Head MD program, College of Health Sciences at Wynn University, Vietnam. She has a postgraduate qualification in psychiatry and medical education. After completing the master's in education, she joined AKU for a brief period when she was selected to lead the learning, innovation, and medical education as inaugural Director General at Higher Education Commission in Pakistan. She is a recipient of multiple awards in teaching and supervision, and she was nominated twice for Ronald Hardin Innovation in Medical Education Award. So over to you, Dr. Zari. So before starting the presentation, I would also like to say, for the panel discussion, we have invited experts from different specialty and disciplines, and I will introduce the panelists after the presentation. Thank you. Over to you, Dr. Zari.
Thank you so much. Assalamu alaikum. It's a pleasure to come back to an institution where I have worked for 1 year, though very brief, but I still have very fond memories working with Dr. Talati, Dr. Rashida, and Dr. Zoon, and of course, our mentor, Dr. Zubairi. So while we are setting up, I do not have any conflicts of interest, so I'm just declaring that before. And I won't be talking much about the theoretical perspective. It's more about my reflective journey while incorporating medical humanities into the curriculum. Thank you. What I plan to do in next 25 minutes is really present a snapshot of the role of medical humanities in health professions curriculum, share the framework that we introduce at my university, and what are the different approaches that can be used. And perhaps with the help of panel, we can share and discuss the challenges and the barriers which we face while incorporating. What do you see? Anyone? What do you see in this photograph? Cute little girl? Anything else? Colors? Different colors. When I showed it to my students in Vietnam, guess what was the response? They said, huh? No, they said this child has got some skin disease. Because they always thought that I bring something to test their knowledge, and they look at the hands. And that was the week when they somehow get to know about scleroderma. So one student was bold enough to say that this is a patient with scleroderma. And I was confused as well. And I say, what makes you think that? And they say, there are marks on her hand. And then I have to explain what henna is in Pakistan. But yeah, then they started seeing the other things. But the first thing was, what is the diagnosis? And then I am also stalking Professor Murad Musa. He is also somebody that has inspired me. And I was reading his post on the LinkedIn, and I looked at that and I say, yep, it's not just ethical physician. Even if you want to produce compassionate physicians, you need to go beyond just asking, what is this? And all the recall type questions. So that is why I think humanities is important. We also know World Federation of Medical Education has got one of the standard which requires medical humanities. And actually, the institution where I'm working currently is a new institution. So I started with a very blank slate. It's a new medical school. I was given all the options, whatever I want, I could introduce. And that's where I started looking at WFME standards very closely. And I say we need to incorporate medical humanities. For me, it was also the new innovative word that we need to have medical humanities. And so what medical humanities is, this was the simplest thing that I could find: to cure sometimes, to relieve often, but to comfort always. This is the whole goal of medical humanities. I also get to know that the content and pedagogy should be integrated into the teaching of medical students, but I think we should not limit it to medical students. It should apply for all health professionals at least. When I was preparing this presentation, my daughter says, you are working in the hospitality sector. It looks like a customer service thing that you are making. I say, okay, different perspectives. The approaches are often interprofessional. And of course, if they are interprofessional, you can't just limit it to medical students. And the ultimate aim is better health outcomes. It is not something that you just do for the sake of fun, because medical humanities is buzzword. So let's show some movies and have some fun. So how does it all start at Wynn University when I decided to incorporate it? The first thing I looked at, what is happening around the world, so I can have some framework. What are the learning outcomes that I want to achieve? Establishing the link between medical humanities and medical sciences, discuss and interpret the readings. And it's not just the reading, there are other forms of arts as well. Be able to critically reflect on what we are seeing, what we are experiencing, and appreciate the role of emotions, spirituality, and the cultural domains in medicine. And that's also very important. And I worked in Australia, I worked in Pakistan, and there are so many things to learn in Vietnam as well, which when I went there, I thought I know everything. I worked in two extremes and I'm going to, but Vietnam is a different country. There are so many things to learn there. So it is a learning journey for us as well as an educator when we are embarking on any project. And again, apply these learnings in developing the compassionate healthcare. This is the image from 2019 when I was developing, okay, what will be medical humanities like? So all the things that I could find, what we will do, I was asking people regularly. And this is the first, I'm still not very much used to technology. I love paper and pen and sticky notes. So this is the first roadmap. And you can see there were so many things. And then when I was asking people, I keep on, it's like qualitative research. Professionalism, empathy, advocacy, leadership, communication, reflection, and self-awareness. And I then realized medical humanities cannot be just a 1 credit or 3 credit course, which is there just for the sake of the name because WFME has asked for it. It needs to be more than just a course. So that was the realization that we need to integrate it across the curriculum, because you can't just run a course and then say, yep, we have produced compassionate doctors. So finally, this is the structure that came into action. In year one, we start with professionalism, introduction to professionalism. And actually that starts with white coat ceremony, which we never had when we were students. But now that's a big thing, a white coat ceremony to introduce them that they are now in a professional field. And we not only do it just for medical students, all the nursing students are part of that nurse ceremony. So we bring them together. In year two, we have got a course, communication and clinical skills, where it is further incorporated. And then medical humanities as a component where I bring it all together, why we have done it so far. The learning experiences which were designed were collaborative. We asked the graduates, we asked the faculty, we also asked the students what they think should be, and the community. It was constructive. It is based on their own learning experiences before they come. And for medicine, it is very important because everybody has got an experience that they want to share. And contextual, as I say, it has to be in the context of the profession that they are embarking on. So everything has to relate to their career roles as medical or health professionals. Different strategies we have used, case studies, movies. So far, I've got 3 movies which I found very interesting. One is The Farewell, which is, has anybody seen that movie? It's in Chinese American, a young girl whose grandmother is diagnosed with cancer. And the family decided not to tell the grandmother. And she's the one who is asking why. Why not? She has the right to say. So The Farewell. There's another one, Polish one, Boogie Doctor, who actually was the first person who did the cardiac transplant in Belgium. And the third one is Awakening for the psychiatry. Again, amazing movies, but I also use a lot of video clips. I watch Pakistani plays and I say, what can I get from them? And Becker is my favorite. If anybody has seen, you should, he's a doctor, a very arrogant doctor, better than the house one. But these are short episodes, but you will find so many interesting things that you can discuss with the students. Group discussions, and I was able to launch a longitudinal e-portfolio for my students right from the beginning. So when they start the course, the portfolio starts with them. Creative arts, storytelling, and reflective writing. Let's share some of the learning experiences that I have been incorporating in the course. This is one of the session in year one where I use visual methodologies. And although it says here session objective, but actually it is something that they do for the whole semester, but this is how we introduce them. In year one, at the end of semester one, so Introduction to Professionalism is a year-long course. At the end of the semester one, I printed all the attributes that they have identified in professionalism. And they have a party and they pick one, whichever they want. They don't know at that time, what am I going to do with it? And they picked it. I've taken the photograph, who has picked one. And then the assignment for the next semester is that you have to present it in a format that you like, with a reflection, what you have learned out of that. So they have got, again, for these activities, you need to give them time. It is not something you say, okay, this is it, next week I want to see. If you want them to think and reflect, it needs to have appropriate time. The first time we did it, we planned to have a session, but that was the time with the COVID, so we could not do it face to face. We moved to online, where each day one student's submission was presented. We had students who use literature, who use visual art, performing arts, and there were blogs and games which were created by the students. Again, sometimes the students feel that it is the thing that they are creating, the game and the thing, and I keep on going back. I'm not interested in the game. I'm interested in what you learned about these attributes and how you can tell other people. some of the student presentations. The first one here, which you may not be able to see, is from Eddie. Eddie used a Japanese art of cutting, paper cutting. Each attribute was typed and then he cut, and the whole image is created with paper, different colored papers. It was about time management, but Eddie said time management requires all of these things first. Then you are able to manage time. The second one is about honesty. This was done by Owen, and Owen was saying sometimes we do mask honesty. Again, I have not brought these reflections, but they are available and they are beautiful reflections. This student, Ian, got patience as the attribute. She used this art clock, and this is a famous drawing, and she used these art clocks to create this whole digital art. So this was the digital art that she produced, and it would have taken lots of things. And that's why I think it was important. I gave them before they start semester 2, because she could think and she started doing it. So the whole image has got thousands of these art glass, and the color combination, everything was done beautifully. People still get confused when I ask them how many hands they can see. How many? Yeah. Yeah, this is observation, the art of observation. I see 4 hands. Yeah. One student created a blog at that time. It was about self-awareness, and she's still maintaining, and I can go and I can read what is happening. Year two. Year 2 is where we introduce them to communication skills, and the question I ask them is, what are the 3 characteristics that you want patients to remember about you? Empathy, of course, is number 1. So they start that, and then the second exercise is, how do you show during your communication with them? Because that's all you have to do with the patient. So how will you demonstrate this? And students are writing, and this is something that I will take longitudinally with the students. So they have identified these 3 things. And by the time they graduate, they should satisfy us that, yep, they have achieved what they started with. Storytelling with postcards. I've got a collection of photographs. Wherever I find a photograph, I will save it and I will print them as postcards. Again, they are lying on the table. Students can pick whatever they want. And then they have to write a story about it. The story has to have healthcare as the theme. How much time will it take you to write a story about this opera house? This is a 1-week task. So everybody gets a different photograph, and then they submit their story in the discussion forum, because I use a lot of online, and at that time we were not even sure whether we will continue with online or offline, what is going to happen. So I do use discussion board a lot. This is another student from Nguyen. This is her story, looking at that opera house. It is about 250 words. I have not copied. The one that I enjoyed personally was a photograph of elephants. And one of the students has chosen, like, I was thinking, what is he coming up with? And he came up with a beautiful story about elephantiasis. So this, I could not, and I waited for that one photograph, what is coming out of that, because he has picked it. But again, very creative students, I must say that our students are more creative perhaps than us, or perhaps we were not asked to write stories at that time. We also have a session on spirituality and religion. And then I also asked them to share their cultural practices that they have observed within their culture, and if they can impact. I didn't know about this. Then when they have to leave for something, there is a time which they select. And at that time, I get to know that at the hospital, which is our teaching hospital, if you go for a surgery, the surgeon actually asks you, is there any preferred day that you want this surgery to happen? One of my colleagues went there and we were surprised, why will somebody ask that? But there is a significance in Vietnamese culture for the numbers and the days. So that's very appropriate. Perhaps you will not ask that at AKU, but in Vietnam, that is considered like a good thing. Similarly, like placing a metallic knife or something, I see it in Pakistan as well. If a child is scared, you put a Caesar there. So you can see so many synergies, but this was again a wonderful exercise where I learned a lot. And there were few about mental health as well, how people treat when somebody is mentally ill. This is something I have not used as yet, but this is something in my catalog. Have you read the shortest story? What is the shortest story in the literature ever published? No. Very powerful. Six words. And when I read it for the first time, it touched my heart. It's beautifully conveying the message that perhaps I would not be able to convey in 1 hour lecture. So this is something I've kept because I always aware of age and stage of the learners. My students are high school learners. We are just starting year 3 now, so they may not have gone through that stage, but maybe in year 5, I will use that. So what? We have done it. And we said compassionate healthcare. So does that make them compassionate? We do not know. But while doing that, I was reflecting on my own experience. I do not remember ever somebody mentioned empathy as a word in my training. And there was a night that I remembered in Ward 7 at JPMC, Dr. Sultan Farooqi's ward. It was a cold night. I was the intern there. I was doing my house job, and there was this lady who had breast cancer. She was bleeding profusely for the whole night. I did call somebody from surgery to come and do the packing. I do not remember even holding her hand. Or she had the whole set of relatives waiting outside on just almost like on a street. I did not even go and talk to them that this patient may not survive. At that time, I was in a different zone. I was about to get married. I was just waiting when this house job is going to finish so I can focus on my newly found love and the thing. But that was the night I remember when I was doing it, that I could have done something better. It also reminded me of another day at AKU lab. That was the last day when we were closing for Eid holidays. My daughter was sick, very sick. I came to collect her blood report at AKU lab. They gave me a white envelope. I had to open that white envelope and I had to read. I do not know what I was doing. I had tears in my eyes. Somebody just came and put a hand on my shoulder and said, "Are you okay? Is everything okay?" And I say, "Yeah, thank you." I've not forgotten that. The warmth of that hand on my shoulder. If we can do that, if our students can do that, if I have learned this now, what is good for me? And I think I've developed a habit, even when I'm talking to my teaching assistants, I do place a hand on their shoulder. But it was somebody that I do not remember the face. And I think if medical humanities can bring that to our students, our health professionals, we have done a good job. Let's hear from the panel. Thank you so much for giving me the time.
Thank you, Dr. Zareen, for the wonderful presentation. And let's move on to the panel discussion. For the panel discussion, we have invited uh, Professor Stephen Leon, and he is the inaugural Dean of the Faculty of Arts and Sciences. He is a cultural anthropologist with an interest in social organization, cultural system, conflict and development in rural and urban Pakistan. We have also invited Dr. Kulsum Riaz. She's an associate professor and chair of the Department of Biological and Biomedical Sciences and holds the first family indoor chair at the Khan University Medical College. And she's also the member of the Humanities and Social Sciences academic team here at Khan University. We have another panelist, Ms. Ruxana Ali. She is the lecturer and the coordinator of Humanities and Social Sciences at Khan University Medical College. She has been with AKU Medical College since 2003. And we have also invited faculty from School of Nursing with Leila Akbar Qasim. She's a senior instructor, School of Nursing and Midwifery, AKU. And she has been associated with Al Khan since 1995, and currently she is leading geriatric and gerontology clinical stream, and she has been involved in teaching advanced concepts in adult health, nursing, cultural health, society, etc. So may I request all the panelists to please come and then we can start the panel discussion. We have participants online as well as in person. We will take comments and the questions from the participants who have joined in person. So, okay, so can we have one more chair for Dr. Zari? So, okay, so any question, any clarification? Yes, Sarah. G, we need a mic. Mic.
Whether it's medical, dental, or whoever. My just one question to you is like, is there any way of assessing medical humanities, or do we assess humanities? In other words, I mean, if a student walks into a medical school and is able to realize the patient's pain and to understand what compassionate care is all about, so do we need to gauge that? And if we do, how do we do that? Thank you.
For the part of the assessment, I always keep it pass and fail because I can't really see a way of scoring two reflections. And after that checked GPT, which has done an excellent reflection for me, I am really not very keen. I've also found in the literature that in some studies, it's about 73% of medical students who do not want to learn about medical humanities. And they say we are selected for the medical program because we are compassionate. And every application that I read for my medical school, they have gone to orphanages, they have provided food, and they have done everything, 20 things in last 1 year. So for me, there is definitely a need. You may assess it perhaps in the clinical rotation in multiple ways. 360-degree feedback would be essential. Patient feedback will be very good. But in the earlier years, I do not want them to do something just to elevate their GPA. I want them to talk and think about and work together as well. So one of the things that I did not mention, I've got my year 3 students divided into 8 groups, and they've got a life-size cutout during this break where they have to do whatever they want to do with this cutout, either as a health profession or a patient or a carer, and I'm waiting what they do with that when they come back in next 2 weeks.
Thank you, Dr. Zareen, for such a wonderful and inspiring talk. Uh, we know that the teaching and learning happening in the humanities classes is very different as the teaching and learning for sciences or medical sciences. So I wanted to ask, who are the teachers, who are the faculty members involved, and have it positively influenced the teaching and learning in other classes as well? Because we know that the teaching and learning happening for humanities is very engaging, is very interactive, is very inclusive. So is it also trickling down to other classes, or has it just remained within? And who are the faculty members? Thank you.
So what happened, because we have got other colleges, we have got College of Engineering, College of Business, and we have a Janet curriculum, which everybody has to do. And there was a course which was called Arts, and it was more about appreciation of arts. And at that time, I say now medical students need more than that. And as I say, that the learning outcomes should actually influence their career roles. So I was able to motivate my senior leadership that my students are given exemption from that course and we rather replace it with medical humanities. My teaching team is Dr. Prani, who is one of the top qualitative researcher. She's the one. I also have Miss Lien, who is finishing her PhD and her background is in psychology, and our mental health counselor. So it's 4 people who actually form this team. And I'm also supported by teaching assistants who we have to brief what the session is about. So that's how we implement that.
So any other comment from the panelist?
You think?
So just wanted to share my reflective journey when I started as a nursing instructor at School of Nursing. So just to reflect that when I got my first teaching assignment that I have to teach a culture, health and society course to the nursing students. So it was a big breaking and, a news for me because I consider myself as a completely a clinical person teaching cardiac and the critical care. So I was too far from, considering myself that I would be, the person who is going to be teaching the culture, health and society course. So my first year, in fact, the first semester was quite tough in terms of, and many a times, I had to, remember the definitions. So this was, and it was too tough for me to translate the hidden curriculum in this cultural health and society course. But with passage of time, I started loving this course. I just, and at this point in time, I just love teaching culture, health, and society because there's a lot of inclusivity, and it always comes from within the care, the compassion, the empathy. Like all the higher education students, including the medical and the nursing students, must have within themselves in order to communicate, to provide care. Because as Dr. Zareen said, it's just, a matter of touch or that hug that really counts. And so like what we all study in arts and cultural anthropology, that because Pakistan is a multicultural country and having a diverse population. So, and every diverse population is coming with a different set of cultural values, beliefs from their own homes. And as a healthcare provider, we need to listen to them. We need to many a times negotiate the care as well, and to fix that, into their values. And so both of the things are met at the same time. So, and so our purpose is also met, and it is a win-win kind of a situation. So again, this is it's an art which the students need to learn right from the very beginning. And right from like we have a session of cultural awareness in year one, semester two. And this culture, health and society course is a 2 credit course, which is being taught to the nursing students at the level of year three. And its implication is being vision or is being seen in through in the clinical courses, because the teacher sees how does the student communicates, provides care, even a touch of hand or a smile, or even how are you feeling today? All this is matters while we provide the care. So it is a must to be there, should be present in all the medical humanities, should be present in the medical and the nursing curriculum. Thank you.
Thank you. Before moving on to the next, so just a quick query. So we are teaching humanities in year 1 and year 2, right? So can it be taught as a longitudinal theme? Because if medical humanities is very important, so why not as a longitudinal theme rather than just in year 1 and year 2? This is my question to the panelists.
I would support it 101%. We've been trying to make it longitudinal, but for the moment, we haven't been able to really stretch it that far. But what I would like to say before anything else is that medical humanities is fine. I fully agree with it. But our mandate, our vision in our humanities and social sciences is it's not medical related. We wanted the students who come, as Dr. Zareen said, totally made up minds that we are coming here to become doctors and nothing else. But what we want them to do is to get an exposure to different disciplines, because Pakistan studies and Islamia are compulsory. So we thought that we would broaden it and bring other disciplines under that umbrella of humanities and social sciences, and give a different touch to the Pakistan studies also, because it's now narratives of and identities of Pakistan, and religions. Islamiyat has become religions of Pakistan, so they learn about different religions, and that has really, really affected them. They are so surprised to see that a Muslim Islam is so similar to Hindu teachings, to Christianity, to Judaism, and that has really affected them. I remember one student, now of course he's graduated, he said that doing this course has made me better informed. So when I see my patients, I know where they're coming from and I treat them that way, I talk to them that way. So that does affect in that way. And aside from that, initially we were hoping that FAS would have started way back when, and at that time it was no idea that the medical students would have a full year there. So we thought that by the time that happens, let's introduce some humanities here. And we started with that. And our intention is not to link it directly with medicine at all. We give them exposure to anthropology, to law, to literature, the arts, music, theater, and languages. So they do that. Of course, they take it pretty easily, saying that, oh, it's chill program, it's ice breaking, it's fun. But later on, I think it does seep in, and somehow or the other, it does impact them when they are in their clinical years. So we tell our faculties not to purposely, knowingly connect it with medicine. Just give them open exposure to everything that they can. So later on, when they go into the world, they are informed in many different ways. And फिर जो भी कुछ होता है, any issues or any challenges that come, they are internally informed and well prepared to deal with them in every way.
So I'm just reflecting on all of the questions that have been asked so far. And I thought when Dr. Sara asked, would you want to assess empathy at entry or at any stage? We've actually talked about this when we look at different admissions criteria and interviews. Am I right, Dr. Tariq, when we think about doing things like multiple mini interviews, and of course, there's feasibility and other issues with that. But I want to agree with Dr. Zareen that it is something that can be inculcated. So this idea of empathy, do you assess it and do you not let someone or enter into med school if they are not able to show it? I think these are difficult questions to grapple with, but it is something that needs to be inculcated through a very thorough program. And that's what Roxana is referring to in the model that we have, but certainly in the model that other people have with medical humanities. Um, would we like it to be longitudinal? Absolutely. And when we've done evaluation studies of the way that the humanities and social sciences is structured at AKU, it's informed the fact that we've gone from what used to be standalone lectures every Friday on traditional Pakistan studies and very traditional just Islamia, which was mandated by the regulatory body, to what became and evolved into first 2 weeks, then 5 weeks, and now almost 15 weeks when we have the foundation. I think it goes for about 12 weeks of that 15. We've been we've been encroaching into curricular time very slowly, but with the support of our colleagues. And the students as stakeholders have come back and said, you know, we don't get it in first year. We get it in third or fourth year, why you teach this. So they make those connections much later when the patient contact starts. So Amber's question of should it be longitudinal? Probably it should be. But I always remember what Dr. Roxana Zuberi said about curriculitis, where you keep stuffing stuff in without taking things out. So we, of course, have to be mindful of how we do this in a way that is advantageous to the students, but they also get their curricular exposure. So I agree with everything that's being said. And just one last thing to Naveed's point about, do we learn anything from our humanities teachers? Tremendously. At AKU, we have a few that we have, over the course of the past few years now, we've had almost like 30 different courses that have been taught, some of them by people at AKU, but most from our partners in this from outside of AKU, not just outside in the country, but even some from beyond Pakistan. So COVID years were great for that. We got people online and we were able to do that. We've learned a lot from them about how to teach, but it's very interesting that it's been a really two-way traffic. With a lot of these faculty, when we sit down with our very traditional models of medical education, there must be objectives, there must be assessment that meet the objectives, it has to be, they've learned from us as well. They're like, really? You must do continuous, you must do... So there's been a good two-way flow of perhaps we've brought a little bit of our discipline to them, and we've certainly learned from them as well.
Thank you very much, Dr. Zareen, for an enlightening talk. I mean, this is something which is very close to our heart, because moreover, when we talk about competency-based education, we talk about individuals who are, competent in patient care with lots of discrete knowledge about illnesses, identifying patterns. Then we stop forgetting about the core of healthcare, which should be compassion. So my question is related to that. A phenomena that goes side by side when you talk about compassion and humanities is a compassion fatigue. How do you teach your students to deal with compassion fatigue? What various strategies do you use in your curriculum? And my same question would be to Dr. Kulsum and Ms. Ruxana about how are we teaching something about how the students can deal up with, the much talk about aspect in this era is work-life balance. So they always question about the fact that how to maintain a work-life balance and prevent the compassion fatigue. Thank you.
I think role modeling. Role modeling is number one. My students know from day one, and even when I was working at UWA, I do not respond to any emails after Friday 4 p.m. to Monday 10 a.m. That's my number one rule that I tell my students. They all have got my phone number. I say, if there is an emergency, I'm available, but I will not respond to anything because that time is for my family. I also make sure that I do not have any announcements for my students on Saturdays and Sundays. There are no deadlines for Saturdays and Sundays. All the deadlines are in the morning at 9 a.m. because I don't want them to submit things and then they are getting crazy because they can't submit and they are sending emails. I had so far in my career one student who got upset And she said, we are paying fees for that. And I'm not responding. And I say, you are working as full-time students. So if you are studying on Sunday, that's your option. I will not respond. But I also give them an option that if they've got any query, they can post on the discussion forum. And perhaps one of the, mainly it is, what is the criteria for that? Where is the rubric? When it is due? So just do it. And one of my colleague in Australia, he had all the list of the questions that the students ask. And it was like an out of office thing that when a student writes to him, it will go, these are the questions. If your query is other than this question, talk to me on Monday. So role modeling is very important for students to know that if we do not show them how we keep work-life balance, if I'm working all the time, they do not appreciate that family is important, and it has to be.
Yeah, Dr. Zeri, so thank you very much for such an enlightening talk. I would like to know that, so we know that all the accrediting bodies and regulatory bodies, they emphasize a lot on the professionalism and empathy and all that. But we also know that at most of the places, these are not really formally taught or consciously tried to inculcate it. So it's expected that they would be learning from the role models and the faculty around. So I want to know what challenges did you face in terms of acceptance by the stakeholders? Mostly because of two reasons. One, you said there is a summative component attached to it. So they either get to pass or fail. So there's a tendency they may be acting out or just faking it. And secondly, especially in third year, if that's also a clinical year at Vietnam as well. So we know, and we hear a lot that the time is already short to learn the interaction with the patients and learn about the clinical skills and knowledge. So how because of these two factors specifically, what was the acceptance or what challenges did you face and how did you overcome them?
I'm very lucky because I was starting a medical school from scratch. So I do not have to face that problem with the stakeholders. I did have issues when I said my students will not attend the course in arts because they are doing something and everybody got upset. Why medical students should be exempted from arts and what is medical humanities? So I think I have to work for 6 months on what is medical humanities, what will be the activities, and finally there was a vote and they say, yep, medical students can be exempted from that. So I do not really face that type of challenge. And I do not know whether Dr. Zuberi is there. Many years ago, I learned from Dr. Zuberi, there is nothing impossible. It may be difficult. It may take a bit longer. So I think that has stayed with me. Don't tell me anything is impossible. I will make sure it's done.
When you have the same mentors, you hear the same thing. We've faced that challenge a lot, right? What a regulatory body says, but there are always ways, and we do jugaad, right? And so this example of Islamia is required, and you have to do 50 hours of it. But nowhere does it say exactly what needs to be taught. That's where the Religions of Pakistan course came from. So nothing is impossible. You just have to find a way. And yes, convincing stakeholders is important. So going through the process of our other clinical faculty trying to understand why would you take away time to teach religions of Pakistan as an example was important, or even the students, or even their parents. So all of that is absolutely important, and you have to go through the steps and the motions, and we've done it to some success, but nothing is impossible. You have to find a way within the framework, and you can.
Thank you so much. Really nice discussion going on. Regarding the longitudinal theme regarding the humanity, I think what I see as a clinician is that in the clinical years, the practical application of these things happens. Empathy, compassion, role modeling, listening skills, a number of things which we practically do and we learn. So I think there is a practical learning of of all those soft skills which takes place in the clinical skills informally. So this is there in the curriculum, but not like as a written curriculum, but it's there. And regarding the work-life balance, as you said, for a clinician, now I have two sides. As a medical educator, right now I'm talking as a clinician. So as a clinician, it's very difficult to Friday, 5 o'clock till Monday, 8 a.m. I can close everything because 24/7 we WhatsApp calls and everything, email portfolios and portfolios. So you need to be in touch with your patients throughout. But I think at the same time, you need to build a work-life balance, give time to the family. अगर आपको 10 बजे भी घर जाना तो उसके बाद भी कुछ ना कुछ टाइम family को देना. And then if you are on the weekends, try to keep some of the time for the family. So I think it's difficult but need to manage. अगर आप कुछ भी टाइम नहीं देना, some of the clinics mentioned they do 24/7 without any break. I think they need some break. So I think there is a flexibility which is needed.
So Dr. Dai, just a very quick point to that. I would agree with you that work-life balance looks different for different professions and different individuals even. But to Sana's point, it's also important to learn the skills of resilience and how to process information and how to process grief and how to process stress. And I think that's an important thing that can be taught, and it's not necessarily innate, right? Not everybody deals with pressure the same way. So how you are able to process or if you have a patient who dies, how do you process that information and what do you do with it rather than just park it and have it pile up? So I think that's just as important and is something that comes from this broader based education.
Sometimes they are struggling, and without any listening. What they want is somebody listening. And I think over the years, what I have learned, कि वहाँ जाके खड़े हो जाए किसी की बात करते हैं. कई दफा ऐसी हमने बातें सुनी है, but I tried कि अपने आप को control रखूं किसी तरह से. And then once they finish, then you start talking. फिर आहिस्ता you build trust with them, and some of them are now very close to us. I think listening is such an important thing. जो बहुत lack कर रहा है हमारी clinician की. Thank you.
Thank you. This has been really interesting and really eye-opening because, in fact, I had a very different model of medical humanities. I worked with a Center for Medical Humanities, and it wasn't about you doctors at all. It was about communities, and it was about well-being as opposed to fixing an illness. So one of the projects that I was involved in was going into schools and making kites with children, and the parents would come in. These were very deprived neighborhoods where a lot of the problems were, sort of the generational changes, that their parents had lost all their jobs because the heavy industry had been shut down, and the children wouldn't have the futures that their parents had, and their parents couldn't imagine what future their children would have. And there was a rift between parents and children, which was impacting children's health and, of course, also impacting parents' health. So rather than go to you experts, who you're very good at fixing broken legs and fixing my heart and all of those things, but how do you deal with a household that can't communicate with itself, which then has cascading effects on people's physical health? So what the project was to create a space, a non-confrontational space, where children and parents and teachers would work with artists, make kites over, and then have a parade in the center. So the community was also brought in, even people who are not part of the school. And these kites that come from Japan, these kites were, with little candles inside them, and they're held up on big sticks, and the kids walk through very proudly with their parents. And it was about well-being. So it was humanities, not to teach compassion, because I don't actually think you can easily teach compassion. As Dr. Karak says, it's something you you pick up. And I actually, as a patient, don't care whether my doctor is really compassionate. I just need them to be able to pretend to be compassionate. I'd much rather they be very good at the technical side, because like my plumber, I don't expect my plumber to care for my psychological well-being. I expect him to fix my sink. expect my doctor to fix my body, and there are other people around me. And that's what, for me, medical humanities is about, recognizing that culture and society are as important for well-being as the excellent surgeon who can, repair my aorta.
So just wanted to take this point further, like in Pakistani context or in the countries or like Southeast Asian countries, this is something very different where the patients would like to, I mean, in addition to the cellular, disease process and the pathology and the disease, the patients would like to hear from their care providers, whether they are the nurses or the doctors or anybody else. They would like to hear from them like caring words and empathy, and in addition to, because the culture, yeah.
But it's what a doctor can actually do.
Yeah.
Doctors think, listen, as a therapist, they listen, but actually that, it's much bigger than that. Doctors cannot provide, it's like expecting police to deal with mental health problems. It's a disaster and leads to police killing people. So doctors need to know what doctors can do, and recognize that actually an awful lot of our well-being does not come from the hospital or the clinic. It comes from our communities. And if doctors can work with communities, I think it could actually enhance medical care enormously. So, the kind of thing you're doing, that horrific short story from Ernest Hemingway, it's a reminder to doctors, children die, and there's nothing you can do about that. You can't fix that. Families and communities are the ones that will help people get through that. Doctors have their part to play, but if doctors start thinking they can fix everything, then we're going to wind up with disastrous doctors and very unhappy patients. And I don't think that's a Pakistan-specific thing. I think that's everywhere.
Thank you. For the people online, I'm Dr. Tabassum Zara. My question is basically, I'll be very brief in asking my question because we know that it's almost time. So my question is to the Dean FAS and also to the lead of Medical College, Dr. Tariq. So jointly, maybe if you can answer to this question. We have heard from all the panelists and the questions coming from the audience that, humanities should be taught in this way, humanities should be learned in this way, and the way students should come up with these kind of competencies and skills. However, I have two sets of questions that can be answered separately or in combination. What is the outcome that we are expecting out of all these teaching and learning from the humanities? And as we have heard from Dr. Zareen as well, that we have to keep a work-life balance as teachers of humanities as well and of in healthcare sector. So what is the role of the institution to incorporate these kind of, practices within the institution and within the culture of the organization?
Excellent question. And your course on culture, health, and society is an important part of the mix. There are culturally specific things that it would help doctors to know, but just the awareness that our communities are as important for our physical well-being as our medicines that we take. That's would really be the message that I want people to get. And, actually, I don't want my doctors to touch me at all. So, I don't want a shoulder. I want them to stay on that side of the room and to be experts and to be sympathetic and listen. But, that's probably coming out of Anglo-Saxon culture. We don't touch a lot, yes. And I'm married to a Japanese woman, and Japanese don't touch a lot. So it's not touching I want from doctors, but the awareness that the doctor should be thinking, what culture, what background, and how can I bring them in? So that really quite painful story about not going to the family, that's something, it's very brave of you, I think, to openly admit that, because I know that must hurt you even now, that you didn't connect, and this culture, so you know how important that might have been. And if we could get people to not have to experience that like you did, but to hear the story, and then when they're in that situation, know that, yeah, I should go out and bring the family in on this because they're as important a part of this treatment as I am.
So I think the idea of having this all humanities, social sciences, and everything, cultural thing, I think it's in an undergraduate student is to build a complete human being. I think they will be dealing with insan people, and I think once you're dealing with people in your practical life, I think you need to be a proper human being. So in order to develop a good human being, I think all these things need to be inculcated into it, so that you, I think as a physician, you need to have a, or a surgeon or whatever clinician, you need to have a expertise in your field. Definitely, I think without that, I think it's a basic thing. But in addition to that, you need to have some how you are dealing with people, because all sort of people would come. So if you have developed these students as complete human being, try to do that. I think that would help in their future life. So that's what my thing is, why it is important. And regarding the life balance, it's all variable for everybody. So the university cannot clearly impose things on individual clinicians जो अपना work life balance करना नहीं चाहते. They just want to earn and earn. So I think it's all variable, because salary structure is like that in all the clinical areas. So I think it's very difficult to impose a clear line on those. But I think all efforts need to be done. Thank you.
Thank you for such an enlightening discussion and the presentation. Thank you so much, Dr. Zari, Ms. Lela, Ms. Roxana, Dr. Kulsum Riaz, Professor Stephen. And with this, I would like to invite Dr. Naveed Yusuf for any comment, concluding remarks, and for the appreciation award for Dr. Zari. Dr.
Thank you so much, Dr. Amber. I think what we have learned today is we know a lot and we need to learn a lot more. This is very diverse, and I'm so thankful to Dr. Amber to not only select Dr. Zari as the speaker. Thank you so much, Dr. Zari, for taking time out. I know your trip to Karachi is very short and you're very busy. And also to make sure that we have diverse panelists who brought in their own views and their own thoughts and their own expertise to our learning. I'm also very thankful to Dr. Mohammad Tariq, Vice Dean, Director, School of Nursing, Dr. Tazeen Ali, and Director, Graduate Studies, Dr. Mohammad Shahid, to take the time out to be here. Thank you to all the participants for the great questions and comments, and also to the participants we have online. Thank you to DED and Medical College Administration to make sure that we have smooth execution of the grand round today. Thank you.